Cloud, hold on.
Is being recorded.
Are we on?
Okay.
Hello, is this thing on?
Oh my God. We're on. We are on. We're on.
We're back.
Welcome back to another edition of
Fit with purpose.
Fit with Purpose.
Put health on the end of that. Fit and healthy with purpose.
Fit and
Because
healthy
this
with
shit does not come by accident. We know that.
getting healthy doesn't come by accident.
No, not even a little bit.
Okay.
Am I right?
You're very, very right. You're very, very
All
right.
right. What are we talking about today?
What are we talking about today? So, crew, today we're talking about, we're going to share some insight on hormones, women and hormones. And it's such a hot topic right now. And we're going to get into, yeah, just some personal stuff, some real personal stuff. So let's go back to a couple of years ago when when I was complaining to Cameron. First of all, share what you do. Obviously, I motivate the hell out of everybody to keep moving their bodies and to stay
And me too.
strong. And yeah, exactly. Motivate the hell out of everybody to exercise and stay strong, and persevere and just change your complete, uh, just get you stronger from. And that's number one for women. That's going to, well, muscle. It's going to increase your lifespan. So that is my sole purpose. And what do you do?
Actually, kind of the same thing, but I kind of come in the back door instead of the front door like you do. So from a clinical standpoint, I figure out what's wrong with people and why they're currently rowing with one oar, going in circles with their current provider, and we address it and we get it fixed. Simple as that.
And so because of that, we've been talking for a long time, Cameron and I, and years ago started my journey of being tired. And we both fall in the aging woman category, right? And it's not that it's a hot topic right now, it's because we're in that stage. Whenever you are going through something personally, you feel like that's what's relevant and that's what's the hot topic because everybody that you know is your peer, right? You are all going through this together. You went through elementary school, you went through middle school, you went through high school, you did college, and now it's like, okay, we're in this stage now. We've had our kids and we are between 40 and 55 and we're tired as shit and everything hurts and we get
We're
injured,
moody. We can't lose weight.
moody,
Exercise sucks. We can't recover.
can't recover, low libido, just you're in hell. You literally feel like you're in hell. And our mother, I don't know if everybody else's moms, my mom never said a word to me about any of this.
Same.
I don't think it was they didn't know what it was because how much money goes into women's research, women's health research? $0 and 0 cents goes into women's health research. To this day, there's really not a lot. And all the medicine is tested on who? Men. Even medicine for women is tested on men, right?
For the most part, you're correct.
So yeah, I was complaining to you a couple years ago about
Mhm.
being really, really tired. And I don't obviously what I share on social media is motivational content. Now that we've moved into 2025, 2026, people want to hear your story. People want to relate to you. That's what draws people to you. I come across as, how do I come across on social media? You tell me.
Me or the audience.
Yeah.
You're loud, you're in their face, you're get your ass off the couch, let's go exercise. I don't care if you don't want to do it, we're doing it. That's it.
I don't care if you don't want to do, you're doing it. Yes. And there's a bit of personal, but not super personal. I don't even talk about age on there, but I am in the category of an aging woman. And I was really, really tired. And you were barking at me years ago. What did you tell me about just me complaining all the time about being tired? I was on nothing, on nothing. This was years ago.
I said you got to get labs and you got to get your hormones checked. And I probably said that once a week for an entire year.
Exactly. I did
When you
not
were living off energy drinks, remember that
Probably. I did not, and I didn't do anything.
before?
Just like a
Yeah.
lot of people who are watching this, you probably are not doing anything. You're complaining about it. You're going to your workout sessions or you're going to work. You're stopping at Starbucks. You're stopping at wherever. You're living again, like she said, off energy drinks. You're doing pre-workouts. You're, and right now, you're probably thinking, okay, I can't lose the last 5 to 20 pounds. I want to turn to GLP-1s. So she says, get my labs done. I think, okay, so I did eventually after you said this umpteen amount of times,
I think you did like 3 years later.
3 years later. It was not 3 years later.
Okay, maybe not three, two,
It was a while though. It was a while.
2.5.
Because why? Everybody is worried about the cost. Then you've got that issue. How much is it going to cost? I don't have medical insurance. What's going on in the world? So let's just, fast forward. I did get labs done. And let's see, I have a hormone doctor, right? I went to a hormone or a functional medicine doctor. There's different names. Hormone doctors, functional doctors, holistic doctors. Now, I do want to also specify that can can your primary, let's get into that, draw your labs? Well, yes, your primary doctor can draw your labs and you can tell them what you want them to draw, but 9 out of 10 times, uh, they don't know how to read them. They don't know how to fix you, not fix you. They don't know how to do it. Or they'll read it to their level of being able to read it because it is not their specialty.
Correct.
Their specialty. And they might give you something here and there, but they're not critically looking at the patterns. They're not looking at labs that were drawn prior. They're not going to track it for you, right? Because it's not like you get one lab and okay, this is what we want to improve and then you're good for the rest of your life. This is something you have to track.
And I think I'm going to tack something on to that. That's both of them go together. It's either exactly what you said, or it's they are not drawing the clinically relevant and diagnostic labs. The perfect example would be women go in and they get their estrogen, progesterone, and testosterone drawn, which is great. And I advocate that. However, 99% of providers draw only total testosterone. That does not help a clinician at all determine how much is usable by your body. So they're drawing the wrong labs. They need to draw not only total, but free testosterone. Free is what is available for your body to use. So if they're looking at your lab val and they're telling you that you're normal because they're drawing a lab that's incomplete, it's not diagnostic. So, and this is the problem with conventional or standard medicine. And to your point, that's why it's vitally important. It's actually paramount for people, guys too, to go to a practitioner that actually understands the correct diagnostic, clinically relevant labs to draw and how to read them.
Exactly. But they don't.
They don't.
They,
Most don't because they're not, and that's not a knock. It's just they are not trained to read those labs and to even know again the relevance to your symptoms. And they can't pattern match that way because those labs are not diagnostic. That's like having a full tank of gas, but nobody's checked under the hood to see even if there's an engine in the car. I mean, you can certainly have a full tank, which is your total testosterone, but if you don't have the engine in the car, the full tank doesn't matter. That's my analogy.
no, it's a really good analogy. And it's just true. It's just absolutely true. And that comes down to everything that she talked about is basically that before, but I already had a holistic doctor. So obviously I was on the right path. But for those that don't, you have to do that research first. Clearly, you have to, best case scenario, just don't go to your primary care practitioner. But once again, like I said, some of them, or you can look it up, some of them do, they are functional primary care providers, and you just have to do your research. You have to do your due diligence, and you have to look around, and you have to not, you can't sit on this, you know what I mean? Because you just feel more and more terrible. And not only
Yeah,
that,
symptoms do not resolve, they get worse.
they get worse, and mine did. Like we were talking about adrenal failure. We were talking about, and who would ever guess? Like I'm on social media making videos saying this, doing that. It doesn't appear that anything's wrong, but you know how you're feeling on the inside. So I did go and got labs drawn. And at that time, I mean, there were a multitude of things that were wrong. First and foremost, or that needed to be, first and foremost, we want to talk about you want to get your hormones balanced. You and I talked about getting them optimized. I'm finally, this is 3 years later, in the category of getting them optimized. There's a difference between balanced and optimized. You want to start getting them balanced, inching toward balance. And that's what I did. And then in that journey too, more issues happened. Um, so what did you tell me? I did get on, I was registering at zero testosterone. So let's talk about testosterone really, really quick, literally 45 seconds. What is testosterone? It's a hormone. We're born with testosterone, estrogen, and progesterone. All of us, men and women. Men have a ton more testosterone, correct? And that's what builds muscle. And a lot of women get worried and say, I don't want testosterone, or I don't want, it's going to make me bulky, or all those things, which is completely not true. We'll never produce enough testosterone to be bulky, but we're born with it. And as we age, just like with estrogen and progesterone, all of those deplete. They all deplete. So, what did you tell me? When you get on hormones, you're just replacing what's going away. It's not like
Exactly right.
it's not synthetic. It's not something that's dangerous for you. It's something that's essential for you because talk about the things that can go wrong when you don't have these. Really
I
quick,
don't think I have enough time, but
really quickly.
it is beyond important that if one person hears this, they have to hear this very moment in time on this podcast, which is testosterone and estrogen. They live in it's like a good relationship. When they live side by side and they're close and they communicate, things are really good. But a lot of providers only give either estrogen or only testosterone. And what happens is that happy natural balance, when you only give one gets high, and that kind of depresses the other one. So that ratio where they live in harmony and homeostasis gets wider and wider. And the symptom that the provider thinks they're correcting by offering estrogen or testosterone or whatever is actually going to make things worse, because that ratio of estrogen to testosterone is getting farther apart. And so then, like you had said, you need you need testosterone for muscle mass retention, for bone density, for pain threshold, for cognitive focus, for mood, for drive, for motivation. When women don't have testosterone, please hear this, ladies, you feel depressed and you feel tired and you have weight around your midsection that no matter how much you exercise or how little you eat, it doesn't move.
Exactly.
Period.
Exactly. So ladies that are wanting this 5 to 10 pound, 20-pound loss and turning to GLP-1s, are your hormones balanced? Are you on testosterone? If you are on all three, hormone replacement therapy and you're not able to, do you know what I mean? That's like you're talking about. We always talk about 9 out of 10 times, get those balanced and you'll see the needle start to move
Mhm.
in relation to, provided that you are lifting, you are eating 3 to 4 meals a day, you're having snacks, you're active, and all of that sounds like it can be not practical in your life, but it is. You just have to plan it in. So going back to, I got on testosterone at the time. I was told by my primary care doctor that I was just going to have testosterone and progesterone. My estrogen evidently was measuring fine at that time. The
At the time.
testosterone was zero. The progesterone, the progesterone also helps you sleep. Um, Progesterone, which I actually just found out, and I didn't know at that time, is also um, helps the lubrication of your joints. And so now after I got on, it was a very low dose of testosterone. It was a very low dose of progesterone. And I had some adrenal issues. So, adrenals, can you explain the adrenals really quick? I wasn't in adrenal fatigue, but I did need a bump to help my adrenals function properly.
Yeah, exactly. And I think it's very important to know that what you said, women need to hear that as well. I want to just back up for a second on the progesterone. That actually works on the same receptors as anxiety medication, which is why women sleep so much better on progesterone. It has a calming effect, which is wonderful. It's wonderful. But as far as cortisol goes,
God given. I didn't even know I had sleeping. She's like, "Do you have problems
right?
sleeping?" I go, "No." The progesterone just knocked me out. You got complete sleep. It's almost like taking it's unbelievable, like
Isn't it though?
narcotic.
Right. Like,
And it's not narcotic. And you don't wake up feeling groggy or this, nothing.
no,
Nothing.
no, no,
Yeah.
no. I
Yeah.
mean, like you said, it's testosterone, estrogen, and progesterone. You come from the factory with these things. When they go away, you need to replace them. And you're not replacing them with anything synthetic. You're replacing them bioidentical hormones. So that means they're the same as what your body produces. And by the way, like you had said earlier, women do not need to be scared of testosterone. As a woman, you are
They
born with
are.
more testosterone than estrogen.
But they are. Women are,
They
but
are.
what's out there, and so, and I want to say social media, but prior to social media, back in the day, we're all told that estrogen causes breast cancer. We're told that testosterone, we're fed the wrong information. And I don't know why. Um, I don't know why we're we're conditioned to stay away. Is there no kickback for the doctors? Is it because it's from has to be prescribed from functional doctors and primary carers don't do it? Like, why was it set up to scare women not to be on hormones? Even me,
Yeah.
I've got, those, it's embedded in grooves of my brain. I remember the whole scare of breast cancer. When you go in for a mammogram, I just had one the other day. The questions they ask you, the screening questions are you on estrogen? They didn't ask me if I was on progesterone or testosterone. Are you on estrogen and have you had breast cancer? Why the fuck are they asking that?
Right. That's a great question. Back in the very, very early 2000s, this this is why the scare was worldwide. And there was a study, it's the WHI, Women's Health Initiative study. The lead researcher, Kathleen Bell, out of the Mayo Clinic, I believe she's now in Jacksonville,
Love it. Keep
they
going.
stopped the study halfway through because and it was a study on giving menopausal women estrogen replacement therapy, which is great. But that halfway through the study, what they found was that what they were giving these women seemed to cause breast cancer, or they had cells that were suspicious. Now, after the study was stopped, not only did Kathleen Bell and the remainder of the team of the Women's Health Initiative study, but the NAMS, North American Menopausal Society, has since come out and they even repositioned earlier this year, they came out with a position statement that said, we were wrong. That was a flawed study because as a result of that study, women worldwide were told to stop. It
All
causes
right.
breast cancer. And they have since come out and said, that was wrong. We were wrong. The reason that they did that this study was incredibly flawed was they chose women that had been in menopause at least 10 years and more. And they had given them a form of estrogen that was from pregnant mare horses.
Why did none
Pregnant.
of this come out? Why did none of this come out?
It is.
And
That's not, you're not going to find it on CNN or Fox.
right.
That's the
They
problem.
only came out with you're going to get breast cancer. There was no exactly what you just said, talking about it was with women who had suspicious cells. It was
Well, now what you have to keep in mind when they stopped the study halfway through, they said, "Oh, we're finding that this could potentiate cancer and cancer cells, so we're going to stop it." They didn't dig deeper at that moment. I mean, they just came out 2 years ago, what in 24, that said the study was flawed.
this is
Now, not only the lead researcher Kathleen Bell, but other people providers and North American Menopausal Society for Women has said yes, bioidentical estrogen, not pregnant mare urine, different. And so the cohort of women that they used, 60 and above, they do not recommend that those women start hormone replacement therapy orally. Maybe vaginally, it's a case by case basis. But for other women that are entering into perimenopause and menopause, they have said this is absolutely necessary for optimization of women's health later in later years.
Oh, there's so much. Well, you just said even the ones over 60 not having it orally. I have estrogen. It's not oral, but I mean, I know there is the pill, that one you can put under your tongue and this and that, but you're saying now over 60. Well, we won't even get into that, but it is but going into perimenopause. So that's 40 to, but is it safe for women over 60 right now? Yes, if they're not taking estrogen in the mouth, is that what you're saying? Or any of the hormone
Well,
replacement?
that's not a blanket statement. It's a case by case basis. But again, the problem with the study is these women they had been in menopause 10 years and more and never been on hormone replacement therapy.
Okay. And now
They're
they're getting
saying
it. Okay.
they're saying there's a couple of different things or a couple of different reasons that that study was flawed. One, it was pregnant mare urine. Two, the women were on oral estrogen. And three, they had been in menopause 10 years and more. All three of those things are a no-go. So if you have the right bioidentical type of estrogen and the woman has not been in menopause 10 years or more, and I forget what the other one was, then yes. And even if they're 60 and they've never been on hormone replacement therapy, that doesn't mean it's an absolute no go. It's a case by case basis that should be discussed with a knowledgeable and informed clinician. So it's not a blanket no, is what I'm saying.
Right. And for all intents and purposes, this is for, I do have a question about if, like you said, it is case by case for if you're over 60. Is there a why to that? Why it's better for women in perimenopause than why is it's blanketed for everybody in perimenopause, but why is it case by case if you're over 60?
Well, it's not necessarily an age point. It's not a number. It's a physiological happening. So, like I, you could be in menopause at 35. You could be in surgical menopause. You could have had all of your, hysterectomy at 25, and then you start hormone replacement therapy at 35. So it's not an age-related number. It is 10 years from your last period, and that could be surgical or it could be physiological. It just depends.
Well, again, and those are the things that just like when the AIDS pandemic came out, people don't even know the difference between HIV positive and AIDS. They're just like, oh my
Right.
gosh, it's the same thing. That's what mass media, before even social media, newspapers, headline news, it's designed to not particularly freak you out, but to get views and to make, and the getting views is
Yeah,
constitutes
make it
making
click.
money. So going back to just everybody you have to do your research. But again, so, okay, so I get on I get on testosterone very low and a very low progesterone and adrenal. So that's where we stopped at adrenal. I wanted you to explain adrenal because I was tired. I was not in adrenal fatigue, but explain why adrenals are important and really quick what it is. And then I'll continue on with my story.
Yeah, sure. So adrenals are a little small size. I believe they're 1 ounce sitting on your back on top of your kidneys. They essentially control your metabolism, the way your metabolism runs. But they're very dependent on thyroid, on estrogen, on testosterone. Everything works together. Nothing in your body works on an island. So if you are not optimized on estrogen, progesterone, and testosterone, and or thyroid, your adrenals pick up the slack. So they work overtime.
Right.
Then they get fatigued. And no matter how many energy drinks you do or how much rest you get, it never completes the rest cycle. And you're in this perpetual state of tiredness. And it's awful. It's the most awful thing I've ever dealt with in my life.
That is, and it is bad. It's
It's
horrible.
horrible.
Mine needed big time help. Adrenal fatigue, you can't even get up off the floor. So like she said, if you're not on those hormones, testosterone, estrogen, progesterone, your adrenals are working overtime and they don't get an opportunity to rest. And that is why you're tired. So you have to have all those labs done. So I was on some adrenal support. I was on testosterone and progesterone. And it because it made a difference from where I was completely depleted, right? To get me out of the depletion zone and feeling a bit better. And I noticed, I was feeling better. Let's just say over time, though, because I wasn't on estrogen and like you just talked about, there was a bigger gap between, because they all work together, the testosterone, the estrogen, I was making a bigger gap between the hormones, especially estrogen and testosterone. And I was also getting injured. I was getting not from, this is just an active woman, getting just, we're talking about arthritis, osteoarthritis, just wear and tear injuries, hip tears, but here's the thing. I I when I started to learn more about estrogen and progesterone, and I learned that estrogen helps with the connective tissues as well, not only cardiovascular protective and everything you've talked about. And then progesterone, I was on it on a very small dose, but that helps with lubrication. I started to connect the dots, and I also went back to my hormone doctor. Finally, this is 2 years after, or a year and a half after I was only on the testosterone, and I had zero estrogen. I did not have any estrogen in my body. And so if you don't have that, I feel like that exasperated my injuries. I mean, I was getting multiple shots in my knee, both knees, my shoulder, 3 hip injections, steroid cortisone in my hip for a labral tear I had. So painful. It was just painful. And again, the hormones they weren't balanced, let alone optimized. Think about it. If I don't have lubrication in between my joints because I'm on too low of progesterone and the testosterone has gone up. So nothing is balanced, right? They're just not working together and there's too much space in between.
Yeah, you had driven that ratio far apart. So testosterone was working more, estrogen was working less, and estrogen is very cardioprotective, protective, and tissue protective. So a lot of women notice at the 40-ish, 45-ish year mark, they start having shoulder issues. More than likely, at least what I've seen, and a lot of these people that I follow as far as hormone replacement therapy specialists, their patients and their clients are deficient in estrogen, which provides that tissue support. So if you don't have it, you get a labral tear, you get a knee ache, you get a shoulder ache, or then you go in for surgery and that fixes the mechanical problem. But that's only addressing the symptom. You need to address the upstream driver, which is estrogen deficiency. And if I remember correctly, when you got on testosterone, you didn't go back to get your labs checked for a minute.
Oh yeah. Yeah.
So had you gone back, you would have seen that your estrogen needed some help, and you would have introduced estrogen and maybe, address those symptoms that caused what you're dealing with now, or what you just came through, a little bit sooner.
Exactly. No, you're absolutely right. And did you hear that? And that's the point. I did not go back. I didn't. And I'm sure it had to deal with money because everybody just, you have to be able to be consistent. I can be, full transparency if it's consistent with exercising and doing all the great things and eating well and motivating people. But, when push comes to shove, you still have to put your money where your mouth is, put out for these things. There's nothing more important than how you feel on a daily basis. If that's more important than going and we're spending money on going to get coffee and going to do this and going to that when you've got adrenals, testosterone, progesterone, estrogen, all these, just these hormones. If you're just consistent and putting money into that's probably in the end, that's going to be less than what you've spent a whole year on. Oh, I need more energy. I'm just tired. That's the first thing. When people are coming to me. Yes, I want to guide you with getting stronger and give you exercises to do and make you accountable, put you in I mean, those are all very, very important, but it's that's just half of the solution to what you need. Now, given that you're in the age of an aging woman, you're not a 20 or 25-year-old.
Right. I think it's important, Val, that we also put out there that whatever dose you start with is and delivery system is not going to be what you end with. So you may, I don't know, but I'll use myself as an example. I started with a cream that was essentially worthless. It didn't do anything for me. And then I went for a troche, which is a gel tablet, if you will, underneath the tongue. That was worthless. And then I got a pellet where they do it's like the size of a rice granule that put in your hip. That was it for me. And now I'm on injections because they're a little bit more cost effective. But the point, and my dose has completely changed from when I first started hormone replacement
That's
therapy. So
because you go in with with your labs because you get them like we just talked about. You get them regularly checked so you can see where you are, how
yes, of
it's
course.
affecting you.
Yeah, but make no mistake. I had a client last year in Utah. She had gone into one of these doc in the boxes on the corner saying that I've got this, all these symptoms. They never checked the labs and they put in, and I don't want to scare people. I want to inform people. They, without checking labs before or after, they put in her 325 milligrams of testosterone pellet. I don't even take that. You wouldn't even take that. And we're active as all get out. This woman was miserable because once that pellet goes in, it doesn't come out. It doesn't. It just fades away over the course of time. And I would never recommend a newbie to bioidentical hormone replacement therapy start with a pellet. Start slow with something maybe like a cream or even an injection. Because if you do an injection, when you pull that needle out, it's done. You don't do it again if you get too much. And the other part of this is providers think that they can dose a woman and that's it. No, this is going to take someone that's going to be especially perimenopausal women. This is not something that you set the dose and you walk away. Here's what's happening with perimenopausal women. Whether they've had a period or not, their ovaries are still sputtering. They're still sputtering along, and then sometimes they release hormones, sometimes they don't. And if you're wearing a patch or you're wearing if you get a pellet, the times that you're low and you're low and you're low, and then your ovaries decide to kick in, you're getting hormone up here on top of what you're already taking, the patch or the cream or the gel. So essentially, you're getting a double dose and you're going to feel like absolute hell. So, what they need their provider to do is called rhythmic dosing. The times that they go up, that's when they stop. They stop doing the injection or the cream. And that is based on a woman's natural cycle, the last 2 weeks of the month. And again, if you're not having a period, this is something where you need your input as well as a knowledgeable provider to know based on lab work and what the client or patient is telling them how to dose them. Because if you're double dosing someone, you're actually doing more harm than good, even though a perimenopausal woman such as you absolutely positively needs hormone replacement therapy, just not 24/7 like a menopausal woman. Massive difference. Massive difference.
Yeah, they're basically then again, you're creating a division just like I had between a big space between not having anything balanced and or overdosing, like you're
Or
saying.
overdosing, right? And
I'm
I'm
now
not overdosing in the sense they're going to die. They're
right.
not. They're just going to exacerbate their existing symptoms and feel like hell for a minute.
Exactly. I did start on a cream with testosterone. I said it was low dose. It was cream first, and then I went right into the injections after that. Now it's injections. And I'm now obviously on, I mean, full hormone replacement therapy. So on estrogen. I have the gel and the patch. I've not done the patch yet. I do have it. I'm on the gel and I'm on a higher dose of progesterone. So this is all protective for my joints and, cardiovascularly as well. Everything you're saying, bone health, it's just important. But once again, I can't drive home, the like this whole thing is about the importance of getting a functional doctor, getting a holistic doctor and getting your hormones, getting on hormones. Period. If you feel, not even if you feel, you do feel. It's not if you feel. There's women, I mean, we have all I actually know a lady that also is on the pellet, by the way, too. I don't know, that will probably come later on in my journey, but it makes a revolutionary difference. And there's times that I am still tired. If you don't get adequate sleep, if you're stressed, if you're Again, everything is not an end all be all. We're talking for baseline health and feeling well. This is what this is paramount. It's
It is.
absolutely
Yes.
paramount. And nobody would ever guess that a woman is going through this. No one ever guessed that I'm
I
going.
think more often than not, Val, when they go to a provider, whether it's some, even a hormone doctor, air quotes, cannot be as informed as we would hope, but especially a primary care physician, they can look at labs and say you're normal. I see it all day every day. I see hundreds of labs, and that's the problem, because normal to not normal, it's so vast. And if this is normal here but you fall just inside normal, you're going to feel like hell. So this is on hormone replacement therapy, but this is where optimization lives. This is a starter dose, and this is having a provider that knows whatever dose you start with, you might in your follow up labs be normal, but you still feel like hell. That's why it's important to get optimized, the dose optimized for you, which is exactly why there's not one dose, nor is there one delivery system. If that worked for everybody, there would only be one dose and one delivery system.
Yeah.
That doesn't work for everyone.
No. And it's just like there's not one exercise that's going to work for everyone because everybody anatomically is built different, squats differently, bends differently. It just has different sensitivities. It's just not that's not practical. You got to be proactive. You have to be proactive and start. So if we can leave you with what are your next steps? If you've been watching and you're hearing everything that we're saying and a lot of this is resonating with you. You're tired. You're thinking about a GLP-1 because you can't lose the last bit of weight. You are in perimenopause. Your nipples are sensitive. You're moody. You're all kinds of things. Hungry, not hungry, just frustrated. You know, number one, call your insurance company. Find out if there is a holistic or functional practicing doctor that is covered under your insurance, or Google holistic doctors, functional doctors, hormone doctors, Google that and call them and see if they take your insurance. Secondly, if they don't fret. I do not have my hormone medicine covered through insurance. My insurance does not cover it. I pay out of pocket. Now, Cameron's talked about different labs on, that yes, you can pay for labs. I want to say the most you'll pay, what is it? I don't know. What's the most they pay? 150? I don't know. What's the most you pay for
I
labs?
think it depends on what they request.
Yeah.
I mean, you
It
can get a
really,
lab for 25 or 525, depending
right.
on the amount what you're getting.
We have a list of what, some deep diving women's hormones that can be tested. If you want that list, then comment under this podcast and we will send you the list, free of charge. So you have that list, but you'll get your labs drawn. And then, but to see a holistic doctor, you guys, it's not thousands of dollars. Initially, a consultation can be anywhere between $100 and $200. I'll just leave it there. And you probably only need to have a consultation a couple times a year. The consultation, you'll basically, once you have your labs drawn, you bring your labs to your doctor and they compare them. You'll want a couple of them so you can ask your primary for the ones that you've past had or had in the past, but bring two, ideally to them, and or unless they're going to draw them, and let them look at them, and then you'll get your prescription. So I will be upfront. I just renewed my progesterone is I think $60, and I'm getting a higher dose now. It started at 40 something. So when you start low, it was between 40 and $60. Let me just say that. The testosterone was between 80 and like 120. And estrogen was, what was my estrogen? It was $30. So it's not, you guys, to feel great, think about everything that you're paying, energy drinks, whatever, supplements, which we're supplement queens and we ride or die by supplements and absolutely love them. But it's not like we're taking them to have a different effect on us. Look at Cameron, to have a different, we're taking them obviously for better performance, right? There's certain things I take, creatine, better performance. If you're doing better performance, you're able to to get through the motion, the range of motion of a particular exercise better, and you're able to lift heavier. And those are where you get faster benefits. You get stronger quicker. Not quicker than if you were doing small ones, but it's just nobody wants to be tired in lifting. So that's why we're taking the damn supplements. So you, I can't lift when I'm fucking tired. So that's why we take the supplements. We don't take them to because we're not doing hormones to give us some boost that we're not getting and creating on our own. We're already doing the other stuff the healthy ways. Hopefully that makes sense. So, anyway, that's the cost, but for those supplements, I mean for the hormones, it's not that much. You can put that aside. If you can go to a concert, if you can go out to dinner, if you can get your oil changed. I mean, there are things that you need to that we do in life to function and to make your life run better. All of you don't complain at all when you go get your oil change. You know it's going to be between 80 and probably $200 depending on what kind of car or truck that you have. And you always do it. You don't like it, but you do it. Handle your body the same way. Get the oil changed. So, any closing
Sure.
thoughts, Cameron? I'll give you the floor. What is the last thing you would like to tell these ladies?
Hormones, thyroid, and gut. Those are the three biggies. And if you fix hormones because you feel like hell and you're optimized and you know that based on the labs and your dosing, there's something else wrong. Because remember, everything is connected. And I can guarantee you the provider is only going to look at one thing. So make sure you find somebody that knows how to connect the dots. Connecting the dots is where you get better, not in treating one symptom. That's my story, and I'm sticking to it.
Perfect. And they will check your, when you get your hormones and stuff done, they will
Mhm.
check your thyroid and you'll go down that path. And we'll talk about thyroid in the next podcast.
Sounds good.
Thank you guys for tuning in. We'll see you later.
Bye bye.
Bye.